Keratosis pilaris, also known as KP and often lovingly referred to as chicken skin or strawberry skin, is a skin condition that bothers so many people, and I get tons of questions about it. So today we are covering what KP is and what you can do about it. If you're new here, I'm Dr. Sam Ellis and I'm a board-certified dermatologist. I'm here to help you understand your skin and find products that work for you. If that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. So what is keratosis pilaris, or KP? It's so common that I find that a lot of people can recognize it when they see it. You might even have it yourself, but they don't know that it has a name. This is a rash that is most often seen in kids and young adults and tends to show up on the upper outer arms, the upper outer thighs, and the cheeks. It looks and feels like small, rough bumps, and those bumps can be skin colored, they can be slightly hyperpigmented, and oftentimes they are pink or red and a little bit scaly. Some people with KP have a lot of redness in their underlying skin, and this redness may worsen with heat or flushing, and that is called KP rubra or keratosis pilaris rubra. One thing that's important to note about KP is that it generally doesn't have symptoms. It can be very slightly itchy and it can look rough or dry, but it's not something that causes pain. It doesn't cause any long-term problems. It's often confused with things like eczema or acne or infections, but it is none of these things. It is a totally harmless skin condition, but a lot of people do seek out treatment because they don't like how it looks. We know that KP is genetic, at least to some degree, and oftentimes kids who are coming in with keratosis pilaris will also have a parent who says, oh yeah, I had that as a kid, or it's something that they are still dealing with. We also know that people who are prone to dry skin and atopic dermatitis, also known as eczema, are much more likely to have keratosis pilaris, and it's estimated that about 40% of people with eczema also have KP. KP for most people will improve as they get older, especially if kids have facial involvement that often will resolve by the time they're young adults. So when it comes to KP treatment, and I don't even really like to use the word treatment. It's more KP management because there's no true cure for KP. It's all about how motivated the patient is, because if they did absolutely nothing, their KP is likely to get better with time, but that can take years and years and years. So if a patient is interested in intervening in the meantime and doing something to improve the appearance of their KP while they wait it out, this is when I will give my recommendations. Now, everyone's KP is different. Some KP will improve markedly with the interventions I'm about to give. Some will have zero response. It's very person dependent. And when we're thinking of what kind of treatments may work for KP, we have to think about what keratosis pilaris is on a more microscopic level. And really what it is it's a buildup of dead skin cells within the hair follicle and right around the hair follicle. So things that are going to be the most helpful are things that exfoliate the follicle and keep their surrounding skin hydrated. One category of ingredients that can be really helpful are AHAs, or alpha hydroxy acids, because these serve as both humectants and exfoliants. They help the skin maintain hydration, but they also exfoliate the skin so they can help with that sort of bumpy skin texture. Those are things like glycolic acid and lactic acid. There are some other ingredients that have been shown to be somewhat helpful for KP, like urea, which helps soften and exfoliate the skin, as well as salicylic acid, and retinoids can also be helpful to some degree. Now, something that's important to mention is all of those ingredients also have the ability to irritate the skin, and KP is very sensitive skin. And so if you're using products that have these special ingredients, you have to do so carefully or mindfully, and it might take a little bit of trial and error to find out what really works for you and your KP. And if you're not experiencing too much irritation from the intervention that you're using, it's important to stick with that intervention for at least a few months, because it can take a little while for the skin cell turnover to normalize and for the skin to smooth out. You also want to have realistic expectations for how much you can expect your KP to improve. So you still might see it there a little bit to some degree, but it should be a little less red, maybe a little less bumpy. We're going for better, not perfect. All right, with all of that said, let's hop into the product recommendations. First up are plain moisturizers. If you have KP and you are not moisturizing regularly, that is the first step. Two of my favorites are the CeraVe Moisturizing Cream and the Eucerin Intensive Repair Lotion. These are both really rich, thick, creamy moisturizers, and it's really important to get in the habit of using these every single day. You want to try to use it after showering or bathing to help lock in the hydration as much as possible. Particularly when I have pediatric patients, I will always start them on a regular moisturizing regimen, and I will often have them do it twice a day to help form that habit. Then, once they're moisturizing regularly and they want to see more improvement with their KP, that's when I move on to the heavy hitters. I think every dermatologist has some of their favorite go-to products for keratosis pilaris, so here are mine. First up is AmLactin Daily Moisturizing Body Lotion. This has 12% lactic acid, which is going to help exfoliate the skin and help moisturize the skin at the same time. The one thing about this product is the smell can be a little off-putting for some people, but it is so good for dry skin, and a lot of people will tell me that their KP does improve with regular use of this product. Probably my personal favorite KP product is the Glytone KP Body Kit. This is a glycolic acid-based body wash and body lotion. They're the ones I personally use just for my general rough and bumpy skin, but it also just overall improves skin texture and tone. So I like this one because it has lots of benefits. And then another KP product that I really love is the First Aid Beauty KP Bump Eraser. It has 10% AHA. It's a blend of glycolic acid and lactic acid, and this is more of a scrub that you can use in the shower. And I find that my teens tend to be more adherent with this KP product than anything else, and I think it's partially because they like that physical exfoliation. They feel like they're really doing something, and they are. I do think though that if you're using a physical exfoliation like a scrub as part of your KP treatment method, it is super important to follow that up with a good body moisturizer. If you are using products with alpha hydroxy acids, it's also really important to protect those areas from the sun because you will be more sun sensitive. Now, everything I just talked about is really for body keratosis pilaris. I wouldn't really use any of those things on my face. You also may see that I didn't recommend any retinoids. And although retinoids can have some improvement with KP, it's just been my personal experience in my practice that products like Differin or other over-the-counter retinols or even prescription tretinoin doesn't seem to work that well. And I also find the compliance is kind of low because it causes so much irritation for people. That being said, if you are interested in trying a retinoid for your KP, I totally recommend that you bring it up with your dermatology provider so they can help guide you in the right direction. When it comes to facial KP, I actually don't treat it that often because it is most often seen in my pediatric patients. And once parents realize that it's not a problem, it's not a disease, it's just a normal skin variant that will probably get better with time, a lot of parents don't really want to pursue additional treatments for it. There is a product line though called Aseptic MD. This was really formulated to treat acne. You can buy it online, but a lot of people have told me that it has helped with their facial keratosis pilaris. So it is something that I will recommend to patients if they are interested in intervening. The main active ingredient in this product line is chlorine dioxide, which helps reduce allergens and irritation on the skin. So if I have an adult or a kiddo with facial KP and they want to treat it, I have them start with the foaming facial wash and the facial toner and go from there. What KP treatments have worked for you? Tell us all in the comments. Don't forget to give this video a thumbs up, subscribe to the channel, and I'll see you next time.